Hello and welcome. My name is Bill. I'm the knee pain guru. I've had a number of questions roll in from my email over the past few weeks, and I decided what I was going to do is once a week I'm going to begin answering those questions in a video format like this to address what's coming up for people, the questions they have as a result of what they're receiving from emails, or questions they have regarding their knee pain, surgeries they've had, whatever knee pain issues that they have questions for, to possibly shed light on their situation so it isn't so much of a so it isn't so fearful for people, because the fear of the unknown is absolutely the worst, especially when it's regarding your knee pain. Just to give you a little bit of background on myself, I actually dislocated my left knee. It's coming up on 10 years. It'll be in December. It was 10 years I dislocated my left knee for the first of 4 times. Ended up having reconstructive surgery on my left knee. I tore the ligament, the ACL, in my left knee, and they also took out 2 pieces of meniscus or cartilage. The past 10 years have been spent for me getting over my own knee pain. It set me on a different path in life, and now I have a practice here in Louisville, Kentucky, where I see clients on a regular basis. What I wanted to do is reach a broader audience by conveying that message over the internet, and potentially we can help more people, or I can help more people. So I have 3 questions that I wanted to address today, some feedback I've received in the email. And one is, what is out there since surgery has not seemed to help? Well, this is kind of the same situation I was in about 9 years ago. I had the surgery, I did the physical therapy, everything went great. From the terms of a surgery, from a surgery situation, everything went great. I had a great doctor. I went to the physical therapy. They got my left leg as strong as my right leg, and they said I was good to go. However, I still had lots of pain in the knee, as well as a lot of pain and tension that was going through the rest of my body as a result of my body compensating for the knee. So what I did is I tried lots of different modalities of body work and different martial arts and things like that, and studied anatomy and physiology and took a lot of different classes, and have put together kind of my own package here on how you can begin to get over your own knee pain. I want to convey that information here in these videos to be able to help you get over yours. One of the things that I have found, and it plays a huge piece, and you never really realize exactly what big of a piece it plays, is water. And you're going to have read that in my free knee pain report, which is, if you haven't already downloaded it, please go to freekneepainreport.com and get a copy of that report. And it's going to go over a lot of these, the topic of water. And just increasing your water intake on a regular basis. From what I've studied and friends that I've gotten a lot of advice from, a good guideline to go by is your body weight divided by 2. And what that number is, that's the amount of ounces of water per day you would want to drink. So once again, that's just right off the top of my head, something very tangible that you can begin to use to help you get over your knee pain. So there are a lot of other things. I've also written an ebook entitled Stop Your Knee Pain Now. That ebook goes in depth on how to strengthen the tendons and the ligaments in your knee, specifically in your knee. Because if you look on any muscle chart, there really are no muscles in the front, in and around the front of your knee. So yes, there are lots of things you can do, and I hopefully will be able to package them in a way that will be easily usable for those watching this video. The next question is, what are my thoughts on injections in the knee? Personally, I have an aversion to needles, so I'm not keen on any type of injection whatsoever. However, I have a friend who is a chiropractor that hopefully within the next few weeks I will get him on a conference call that everyone will be able to listen in on, that he says there is some real good results he's been getting as far as a different type of injection that would go in the knee that helps restore whatever is going on that's causing the pain. So that's kind of my own personal position. I don't like injections. However, there are lots of different perspectives about it, and I hope to get some conference calls and some other things going that will allow you to see some of the different options that are out there so you can make better educated choices on what's best for your knees. The last question, or it's actually feedback, it's from a Karen. Her response is, this is regarding some of the emails that I sent out for my knee pain book. And she says, I don't believe you. I have been suckered by them all. Well, Karen, I completely understand your position. There's a lot of misinformation out there, and especially on the internet. And what I would suggest is that I'd rather you didn't believe me. Because what happens is when you prove it to yourself, then you're really going to own this information. And that's what's most important. It's not about you believing my word or believing testimonials from other people who have tried my product. It's about you proving it to yourself. And there is lots of information that I'm going to be passing along by video, by audio, by email, that you will begin to work at on your own, in your own home, at no cost to you, that if you put forth the energy and time and effort to do so, I do believe you're going to see results. So, please be skeptical. Please be, skepticism is very good. So, anyhow, I hope this has answered your questions. If it hasn't, please send me an email at bill@thekneepainguru.com. And what I will be doing is on a Wednesday or a Thursday each week, I'll get these videos up to answer those questions that I receive via email. Thank you very much, and to your pain-free knees, go in the kitchen and get yourself a big glass of water. Talk to you soon. Bye-bye.